Georgia, and I'm Rebecca, Georgia. I am a naturopathic doctor at the Family Clinic of Natural Medicine, and I've been practicing for about 12 years here.
Yeah. So Robert Coleman, originally from California, been practicing for 12 years, not here at this location, about 3. So before I was at a Fox Valley Wellness Center, Lyme disease kind of centered place, and before that, pain management. So it's been a transition, and we deal with whatever comes through the door. So we have neurological, immune system, autoimmune, a lot of cancer. So we deal with kind of a mixed bag of issues. We have an MD on staff that does knee injections, and he's a veteran, and he's got some neuropsych background. So we have a kind of a group practice here.
Yep, and we have 2 other naturopathic doctors too. We just hired on one that focuses mainly in cancer, and then Dr. Hinkle is with us too.
Yeah,
so,
yeah.
I know Christy had sent some questions that she had kind of talked to you guys about of what you're looking for. So I was just gonna kind of start off the bat of a little bit of what a naturopathic doctor is and how we treat things in general, and be a little vague. And then I like research. So I pulled up a few double-blind studies that I had sent. It was just a screenshot, but I sent the links to Christy, and she can, that way if you want to look at them or look deeper, you can Google the article if you want to see what I'm referencing, but just of some natural support that I've done research on for ALS. So as a naturopathic doctor, our goal is to really try and treat the whole person, try to find the underlying cause, use more natural processes, supplement lifestyle, diet as much as possible. We are trained as primary care physicians. Every state has different rules and regulations of what we can and can't do. Wisconsin, we just got licensed a few months ago. It's not 100% in place yet because there's a bunch of legal board stuff that needs to take place, but eventually insurance could accept what we do here in Wisconsin. And that's going to make it easier for more people to be seen and get access to us. Again, we have a medical doctor on staff, so we can do things a little bit differently here. So when Dr. Coleman, he might talk about like low-dose naltrexone and IVs, we can do that because of him on staff. A new patient visit in our clinic lasts about 2 hours. And again, we're not, I mean, I'll use ALS. We're just not going to talk neurological. We would want to talk about everything. Like, we want to know, what are you eating and how are your bowel movements? And, you know, basically the whole 9 yards, because you are more than one thing in one system. So we like to think across the board. So with anyone coming in, if they think they're coming in for constipation, I'm going to want to hear about how you're sleeping at night, because everything relates to everything. So if you don't have those good backgrounds in, you know, a good diet, good bowel movements, good sleep, good stress management, you're also not going to function very well. So all that stuff is very important to us. And that kind of makes us a little bit different, and spending a lot more time, you know, again, new patient appointment is 2 hours. A return patient is 45 minutes to an hour. So really getting more in depth.
Right. And I've learned just through practice and having teachers who say, you know, focus on an infection that hasn't been treated or not treated fully, immune system responses like cytokine storms or mast cell activation, or you know, different processes that cause the degeneration of tissue over time that can result in pain and nerve degeneration. So, you know, a lot of times there's a link between a traumatic event or an infection or infections, co-infections as far as Lyme disease or vector-borne illness that can lead to rapid deterioration or slow deterioration of the neurological system. So those kinds of things we focus on. We want to always hit, you know, with anti-inflammatory. So we work that up, and seeing previous history and the track the progress of the deterioration is important.
And that's where too, we might do different types of lab tests. Again, depends on per person. Like maybe you'd want to do an antiviral, or workup and Lyme workup. You know, I like looking at food sensitivities as inflammation. And again, it depends on person per person. It doesn't matter if you're coming in for fatigue or ALS or menopause. You know, we might want to look at a bunch of different things. Or how's your thyroid functioning? You can't function good. Your dog. So sometimes our labs go a little bit different and beyond the classic lab work than you might traditionally get, because we're trying to treat people individually of what they're coming in with.
The one popular one is the neuro lab, which we like, the HPA profile, which is a hypothalamus pituitary and adrenal gland axis with dopamine and serotonin, which is important with neurological or depression or anxiety or post-concussion syndrome, sports injuries, things like that. Depression is huge now just because of COVID and things like that. But we want to work that up and make sure we stabilize the gut, repopulate with microbes that help communication between the brain and the nervous system and the GI tract. So we're always kind of forward thinking so far as what to do for progress, what to do to help increase function. And it always boils down to the gut health.
And then specifically, we'll kind of dive a little bit into more ALS. So I would say, I mean, it's not like our practice is an ALS practice. But we do see a lot of neurological stuff. And I think it's becoming more and more popular. I would say even within my last couple of years, I don't know if just naturopathic medicine is getting the word out where people are coming in, but people want to look different and look at other options. And I think it's really just trying to enhance health, enhance life, and how can you be the best functioning person you possibly can be. So we're seeing a lot more of just chronic stuff. So, I mean, again, I think we all have just a spattering of ALS patients. And, you know, I would say just as a practitioner, every person is so different too. So that's the cool thing about our medicine is really looking at that individual person. And I might say one thing to one person, and I might switch my thought for another person because we are all different. And I'm sure you, even in your group, you guys probably all have different symptoms. You know, maybe the same core problem is occurring, but how it's manifesting is different person per person. So that is interesting. And what does that mean? And how can we fight that inflammation? I don't know if I have anything else on that.
Yeah, so patient-centered medicine or holistic medicine, that's the base. And we take the case, we look at the standard kind of HPI, history of present illness, but then we incorporate the emotional, psycho-emotional, psycho-spiritual, just getting a little bit more deeper in what makes that person function or the lack thereof. And then also the belief system, the attitudes, things like that, just getting someone's hope back to say, hey, you might have this life-threatening illness or diagnosis or whatnot, that you have a weight on you. What are you doing to cope? Like you have to have something outside of just studying the deterioration that lifts you up. If it's a religious need or something like that, we'll talk about that as well. So, but tolerance is key. A lot of times people, they can't tolerate a bunch of medications or supplements or dietary changes or whatever it is. So we have to kind of select and edit, and I have to do that with every patient and just make sure that we tailor a program that's not cookie cutters, like, okay, you plug it in, here's glutathione, IVs, and just do that for 6 weeks or 10 weeks. It's got to be like you're checking in and making sure that they're tolerating what they're doing, because if not, you can adjust it and make a change.
Okay, I'll switch gears a little bit, and I know we can take questions too. I don't know exactly how we see them on here, but I kind of came up with four-ish things that I kind of did research on of what the latest. I like looking up double-blind studies just like a medical doctor. It's hard to get natural double-blind studies always because they're not funded by drug companies. So you can't get really big, huge studies. But again, this is where we differ, and we want to look like, hey, it looks like this isn't harmful to a person and there's potentially benefit to the person. Why wouldn't we try it? Always harm, we don't want to do anything that's harmful. And, if, as long as that has been ruled out and there's some potential benefit, I think a lot of us are pretty game of like, hey, this sounds like this could be a good fit. And then again, if Christy, at some point, if you can just send out my little, my little email shots that I sent out to you earlier today. So if you guys want to look at the full article, you can have access to that.
I'll send them out in my post email wrap up.
Perfect. So, one of them, and I know we talk super fast, and I know it's probably a lot to get here, but I think, Christy, do you take notes too for everyone? Okay, perfect.
Awesome.
Okay, and definitely feel free to follow up with us if you have questions on what we're fastly saying. So one of the things I wanted to bring up is something called N-acetylcysteine, or NAC, NAC. They're all the same kind of word. People call them differently. This is an amino acid, and it's a precursor to glutathione. So I originally when I was doing research, looking up glutathione to see if there was some really cool studies for glutathione and ALS. And I didn't find a ton, again, and I could have looked a lot longer and harder too, but I didn't find anything as specific as I wanted. But there was some done on NAC, which, again, you could probably speculate that both would do the same thing. NAC is just a precursor. And this was done in an animal study. So it wasn't done in a human, it was done in a mouse, but it prevented free radical damage, which is, inflammation. Anytime you have breakdown of anything, you get free radicals. That's what damages our skin from sun. You know how we get those sunspots? That's free radicals, and that makes us age and creates inflammation. So, and NAC does this with a lot of conditions, but when they fully looked at it in an ALS, they prolonged survival rate with using NAC in the mice. So basically they had a mouse that didn't have NAC, and then a mouse that got injected with NAC, and the mice that had NAC injected had longer survival rate with ALS, which I'm like, hey, NAC isn't going to hurt anyone. NAC is so good for lungs and kidney. It's an antioxidant. So I think of NAC as a win-win-win. Why wouldn't someone want to take NAC? Even if it was in a mouse model, and you could say, well, it's not in a human, but again, I don't think there's any harm for NAC. Dosing, they don't really give great dosing in a mouse model, but usually typical dosing, I would do like a 500 milligram 3-ish times a day. I know, is that?
Yeah, about 1,000 twice a day, so about the same.
Yeah, so 1,500, 2,000 milligrams daily. I have not really seen anything in high dose hurt a person. I mean, I've not had side effects. I use it a lot for my allergy patients. I use it a lot for lung and cystic fibrosis patients. It's used a lot. So I've reversed kidney damage in individuals with NAC. So it's a really cool nutrient. So, I mean, that might be something you could always ask your doctor if you're going to add something that they might not be as familiar with NAC, but it's something definitely to look into. Any notes on NAC that you, okay. I'm just going to keep on going through my little things and I'll let Dr. Coleman talk. I liked, I have my little notes here. There was a study that I found that I don't think we can say causes ALS, but they were looking at individuals that have ALS and individuals who don't have ALS, and what is their difference? Like, what is the difference in the vitamin workup, which I think is pretty cool. Now, some people would say, well, that means that, did ALS just deplete those vitamins? Maybe, or were those the vitamins depleted and that's how ALS got turned on? I don't know that answer, but I think of it as, if I have something going on and my vitamins are low, those vitamins can also cause additional side effects. So is that why one person with ALS maybe has this issue versus this issue? So I think it's a cool look of like, they found that they looked at 3 specific ones here. B2, B9, and vitamin C were significantly lower in people with ALS. So vitamin C is an antioxidant. Everyone's familiar with that. So again, taking some extra vitamin C, great. You know, I can't think of that really as being harmful. Too much will cause diarrhea. So if there's a little bit of an issue there, you want to watch dosing. B9 is folate, folic acid. I'm very picky with folate. There's a couple different forms. So the generic form that most people get is folic acid. I like the methylated version. So this is methylfolate. So if you're looking on a vitamin bottle, don't get regular folic acid, get the methyl. Methyl means activated, and a lot of our bodies don't activate folic acid to begin with. So this just makes it activated and potentially more helpful than plain Jane folic acid. But folic acid in general it's the building block of DNA. Like it's what's used when babies are being born. So there's no neural tube defects and spina bifida. So it's very, very potent on the DNA and neurological system. So it's interesting that that was found to be lower in ALS patients. So you definitely can take methylfolate. They didn't give any doses. I mean, I could guess and say, you know, start with 800 micrograms, see if you can go up to 1 milligram. Again, make sure it's methylated. Usually no side effects. Sometimes B vitamins, when you start high too early, people can feel a little wired or agitated. So you can always go lower and go higher. But that could be something useful. And then B2 is riboflavin. I don't know, I don't use riboflavin much on its own, except I do use it in migraine patients, and it seems to really help them. So if you think that's neurological kind of inflammation too on a different sense, and riboflavin works really good for migraines. I, again, don't know why ALS. I would have to, you know, we could guess. I mean, it plays in the TCA cycle and things like that. I mean, it's a precursor for a bunch of things, but that's something that you might not think of. Now you could get all these things in a good multi, but you might want a high dose. Like for migraines, I mean, I usually go pretty high dose, and you wouldn't get that in a regular multivitamin. And same thing as vitamin C. You might get 250 milligrams in a multi. That's probably not therapeutic level when we're dealing with trying to reverse inflammation and oxidative damage. So I don't know if you have any things to say on those nutrients that I found.
Sure. So just backing up to methylation and MTHFR and CMT and CBS, and you probably read about all these different intricacies of that pathway. Have you guys covered that already? Oh, no.
That's a lot of stuff. Okay, that's a lot of stuff.
Sorry. So anyway, going back to the folate, MTHFR is the enzyme responsible for creating methylated folate, which pushes the pathway to create homocysteine, which we test for insofar as the accumulation of stress against biochemistry. You want to make sure that things are flowing. You're creating dopamine, you're getting rid of ammonia, you're creating new DNA. So if you add folate to the system, it's kind of churning the keystone of that. But you can have mutations that back up that pathway and then cause aggravation. So too much methylfolate or cyanocobalamin or anything like that can gunk it up, and you could have symptom aggravation. So just got to know where you're at. You don't want too much at one time, and just make sure that you do that assessment if that's a family history or there's any clues of the neurological system being as a result of neural tube defects or not properly adequate nutrition in the past. So that's something we look at too, is methylation.
Yeah, and we can test some of those things too. Like most of the time I'll talk to patients and say, hey, you know, based on this, should we just guess and should we just give these nutrients, or should we dig deeper? And, you know, there's micronutrient tests that we can do to see, you know, I mean, those, it's kind of expensive. The one we use right now is like $2.99, but it will kind of tell us what your system is depleted in, which might be useful. Like, is it going to reverse everything? You know, probably not, but I would like to think of it as it's supporting your system, and the more support for your system, the better it is. And right, we can test homocysteine, we could test methylation, we could go above and beyond. And that's kind of where we'll work with individuals too, of what do you want to test? Do we want to just try? Again, some of these things wouldn't hurt you, so it doesn't hurt to necessarily just try. Okay, I have two other nutrients that I just want to give you some spotlight. So one is carnitine. Carnitine has pretty good research. There's a lot of articles with carnitine. There was research on acetyl L-carnitine and L-carnitine. They're a little bit different. But I think the main reason carnitine is helpful is it really helps preserve muscle, because muscle loss is a common thing in ALS. So it can really help preserve. And carnitine, again, I found another study that carnitine is deficient in ALS people compared to others. So again, that's probably with muscle loss and stuff there too. They did, I can't remember the drug, and I didn't pull that study, but they actually looked at carnitine mixed with a medication that they were using, and the results again were better. And we're talking like progression. So carnitine, a lot of information out there. It looks to be like 3 grams or 3,000 milligrams is kind of the average dosing that people are using, which is pretty high dose. So when you get a supplement of carnitine or acetyl L-carnitine, you might only find the capsules 250 milligrams, maybe 500 if you're lucky. So remember, taking 1 capsule a day is not going to get you to where you want to be. I often find patients underdose in supplementation. They just think because the bottle says take 1 or take 2, that is going to achieve what they're looking for. But in carnitine, you might only be getting 500 or 1,000, where the studies show 3,000. So make sure if you're going to do carnitine, again, I can't really find anything negative for carnitine, but high dose carnitine seems to be useful. I don't know if you have any.
And we have access to that through IV therapy, and that we can definitely achieve that dose with 1 treatment. Usually that will last about a week through IV push. So obviously you can't get IVs every day, but that's something that we can work in. And I believe your foundation has the information on some of the IV therapies that's approved through the ALS Foundation, correct? Like the weekly glutathione and stuff like that, which we follow those protocols as well. And then I'll talk about chelation and stuff later.
But and then I was gonna make note on fish oil. So a lot of neurological conditions generally are missing good omega-3s, which I just call fish oil, but omega-3 is the big component. Fish oil is just really high in it. A lot of saying that, so this study that I pulled was people that actually were doing high dose fish oil tended to not get ALS, or they were the later the onset. So it really was, how was their cell membranes covered in that good omega-3? How was their system before ALS happened? So there's really good evidence, which I'm going to tie into diet here in just a second, is make sure you're taking high dose quality fish oil. I like Nordic Naturals as a good brand. There's other good ones out there, but don't just buy Walmart's fish oil. It could have toxins and heavy metals, which would not help. I will say sometimes fish oil might not be indicated for every person, depending meds. And I mean, that's something that you have to just be careful for blood thinning. If you go high dose, usually it's not a problem, but potentially it could be. So you just have to watch out for that. You might bruise a little bit more with fish oil. If there's surgeries, you need to pause fish oil before that. But fish oil is so good for neurological, like brain development. Like in MS, it helps, well, it supports the axons, which helps nerve signaling. MS is just classically known to deteriorate that. But again, anything that you can do to make your cells strong, fatty, and healthy supports that neurological tissue. And that I'll just segue into diet. I love diet, and I love figuring out foods and things. And so in my research, I'm going to tell you this, but I don't like this. But I like saying what I found. So definitely a high fat diet is encouraged for ALS. And I would say to tweak that, they didn't go in detail, but you want high, good, I would say like saturated fat, like coconut, possibly even butter, MCT, things like that. I would stay away from like the bad seed oils, like some of the omega-6s like canola or soy. those are probably going to be more pro-inflammatory. Now, they didn't look at that. They just looked at any fat was a good thing. And so I could argue, yes, fat's going to be a good thing. It's going to help your brain. It's going to help your nerves. Fish oil, omega-3 is anti-inflammatory. So that's going to be the better choice. But when you're looking to get in nutrition, especially a lot of ALS individuals start losing weight, you want to eat high calorie, high fat. So in these studies, it was looking like what's better, a high carb diet, a high fat diet, what seems to work better for ALS. And in this research, I'm kind of a pro, I don't always love high carb diets, but here is where I think my information was fun. It seemed to not matter. Now, I would love to go and do a different study, but really it was high calorie diet is what helped an ALS patient. And it seems that a person that has more body fat does better with ALS. So the moral of the story is you guys got to eat in any shape, way, or form. And whether that's making a special fun protein drink with, you know, I was reading that there's some good websites with recipe ideas, and like some people were just cracking eggs in there and, you know, drinking eggs and protein powder and put coconut oil, like things that you wouldn't really want to do as a, you know, like you don't want to drink a ton of butter and fat. You do. So, you know, have the like avocado, eat a ton of guacamole. Like this is the time where if you can put on weight and eat your calories, eat. A lot of the studies were saying that really helped delayed progression. So this is not a time to be necessarily low calorie. It's really high calorie diets seem to be beneficial. And I guess carbs would be good in this case too. It seemed that both, it was hard to say what one was better, but the main takeaway is high calorie.
And there was a question about a vegan source of fish oil, or sorry, omega-3s. So there's argan, which is from algae. You have also the flax, you have hemp, you have chia, of course, coconut's good. So you do have other choices. If you're vegan, you know, just have to make sure you check your B vitamin status, check your iron, make sure you're eating enough protein. That's usually the thing that falters the most often. And anemia, I see it a lot. So we check those labs regularly. Every couple months, basically, we're getting an assessment of the hormones, of the nutritional status, and sometimes neurotransmitters, just to make sure they're kept up on. Then there's a question about the gut biome and ALS. So that testing, the Genova diagnostics I like, and I'm not sure if you use that a lot, the GI effects, which looks at the digestive enzymes, the bacterial profile of the gut, your, you know, basically the microbiome determines, in some cases, neurotransmitter production. So the mind and the gut are connected. So if your gut's off, which we see with Parkinson's, we see that with bipolar, we see that with depression, we see that with schizophrenia, you see that also with ALS and MS. If your gut microbiome is altered through previous antibiotics, through trauma, through surgery, through whatever, then you need to kind of really focus on that in order to improve function.
Right. You want to make sure, again, absorption is a huge issue too. And I know sometimes, right, there's a lot of different reasons ALS, maybe you're not absorbing if you can't get in the food you need to, but still if your gut, if you're not digesting properly, you can be eating all the food you want to, if you can, but what if you're not digesting and absorbing, then it's not going to be useful either. And then just a little comment with vegan. I didn't see any studies, but I didn't look super hard if vegan or animal-based would be better. But I would argue that people that are vegan tend to be low in B2 as well. So if that's something that's already a little bit low in ALS patients, you need to be very careful. And I would say you want to eat high calorie. And sometimes it's hard to eat high calorie being vegan. So that protein is what builds your muscles, and muscles are deteriorating. Don't have your diet be a reason that your muscles are deteriorating. So you really need to pump those protein powders that are plant-based if that's what you're choosing. You just have to work a little bit harder, I feel, if that's the diet you're choosing just based on some of the nutrient intake.
Sometimes with gastroparesis or impacted stool, it's hard to just get food in. So some people have the option of NG tube, or, you know, they have to go that route. So we can, you know, refer to a dietitian or do that kind of stuff to help with a regular meal planning, because that is important. When you stop, when you go down to one meal a day with a snack, you're gonna be extracting your nutrients, especially the amino acids, from storage, which is your muscles. So you see that wasting state. So we want to avoid that as best we can.
I think I'm done kind of saying my little points. I don't know if you have anything you want to touch base on.
So the tidbits about IV therapy, Myers cocktails, pretty popular. We can add the carnitine to that. That has vitamin C, the magnesium, the calcium, the potassium, things like that, trace minerals. So we do some testing through the urine. That's a heavy metal test, which looks at mercury and lead and arsenic and cadmium and aluminum, which you've probably seen some of the links with aluminum plaquing and things like that in the brainstem. And so we want to do an assessment to just make sure you're not loaded up. I have had a couple patients, we hit the heavy metals pretty hard, and the neurological system kind of faltered. It's like, is Randy here today? Randy, yeah. So Randy can attest, like we did a workup and we're like, okay, this is what's going on. We shot to that, and he basically he had a significant aggravation there, which obviously we don't want to see, but that does happen. So rebuilding that back up, stabilizing the nervous system. Once we see that there's lead, mercury locked into the nerves, we want to, basically look at the tolerance of that person and making sure that we can have an effective treatment, that it might be slower, but still we could track progress. So a lot of that stuff is quantitative. We can measure it again and make sure that we're pulling those out. But heavy metals are very popular workup for that. And then also, insofar as the gut, we want to make sure that we have microbes that help you produce neurotransmitters, specifically dopamine, which is important for control, acetylcholine, fine motor movements, those kinds of things. And you always want to practice that if you can, rolling the tennis ball with the leg or moving the toes, if you can, arms, things like that, head. Try not to just, because you go to neurologists, they just basically say you've got ALS, it's a death sentence, you've got a timeline to have a great life, but that's not the end all and be all, right? There is work you can do daily, physical therapy, things like that, which is there's no protocol for ALS, so it depends on who you're working with. So I like to put that plug there for that as well.
Yeah, using other sources of alternate, they don't do it, and I didn't look it up, but like acupuncture and occupational therapy, physical therapy, massage. All of that stimulation, it can't hurt for sure. So, and there might be really good articles, but use some of those other sources too. It's affecting you physically as well as mentally. So don't forget that physical piece of medicine that could be useful.
Any other questions that we can address while we have 10 minutes here?
Glenn, where are you at? I know you have questions. Joan, go ahead.
I do have a question on light therapy. Is that something that you guys provide or have done any research on, the red light therapy?
In so far as like the cold laser, warm laser, or the 670 nanometer one, which one are you talking about?
I don't have any specifics. I just know that it was presented early on when my husband was diagnosed, and the studies that had been done showed a great benefit in energy for Parkinson's patients. And we had a couple who, he had Parkinson's and she had ALS, and they both tried it. It was very difficult for her. They had a West Side location that she had to climb into and out of the bed, and she didn't feel like it gave her any more energy. So, but
yeah.
I don't know, what.
Yeah, we don't do that here. Again, it seems like a tool that wouldn't hurt. So, in any of those therapies, as long as, I always say, it's always worth a try, if it's not going to hurt you. And then I think you just have to see, are you getting benefit? How much does it cost? Because you don't want to be spending a ton of money if it's not doing anything for you either. I know sometimes money is a stopping point. So give it a try, but I don't know if I can speak to it.
Full spectrum light's a good idea, just because you can increase serotonin and the mood. but there are specific nanometers of light that they're tuning towards the red light therapy. I think that's what was used. Wasn't a part of that talk, so I'm not exactly sure. But that's been shown to help cellular regeneration. They've got like Juve lights. They've got all kinds of contraptions, stuff you can hang from the ceiling and beam at your face for beauty marks and stuff like that. So that is a little bit more popular in spot treatments and things like that. But macular degeneration and retinopathies and stuff like that, they are using the 670 nanometer spectrum to help with neural tissue regeneration. So that kind of stuff is up and coming in research. So you'll see more of that coming in the next couple of years. So I'd say, hey, try it. If it's helpful, then you want to continue it.
Thank you.
Thanks, Joan. Kathy, I know you raised your hand. Go ahead.
I was just going to ask if there is any, what your guidelines would be in terms of if there's kind of a recommended calorie count per day, and then if there's any difference in like being consistent in 3 meals a day versus is it important to have snacks? Does any of that come into play here as beneficial one way or the other?
Good question.
So I don't know if there's a specific study, and I'm torn because a lot of different health conditions, I actually think meal spacing and not chronic snacking would be beneficial. But then when I was researching ALS, it kind of goes a little bit outside of my realm, because it looked like just get as much calories as you can. I think resting digestion is super important for a lot of other individuals. So I don't know. I think right now it would be just get calories in and, aim for, try to gain weight, I think would be the goal. Definitely maintain is the first goal. And second, if you can put on, and at this point, I think even putting on fat is important. Like studies show that obese individuals don't usually get ALS, which is very interesting. And they even showed, which is really strange, that diabetics don't get ALS. Now that goes like, to me, I'm always trying to like treat obesity and diabetes. So it's very strange how this seems it seems like the opposite of everything I would tell people. So I guess if we're going with that, eat as much as you can whenever you want. But I don't, that's just my guess. I mean, high calorie is what it's been saying, but I don't know if timing really matters in this case, but I mean, you might get full fast, so yeah.
That's the consideration too, is the tolerance of food, larger portion, smaller portion. If someone can only tolerate, say their leptin's high or they have issues with the peristalsis, you want to make sure that they have meals, but they might not tolerate a larger meal. So you just have to do it more frequently, every hour, every 2 hours, 4 hours, whatever is tolerable. Just we want to be balanced.
Come back later.
Sorry, I missed that discussion. I had to be away. So.
That's any questions?
Well, no, you were talking about meals and calories and stuff, and yeah, I've got that situation with my husband here. So anyway,
does he have a problem with food intake?
No, not really. But you talked about the constipation stuff. I just think he eats way too much sugar and doesn't drink enough water, for one thing.
Okay.
And doesn't eat enough vegetables. So the fiber thing. So, yeah.
So what we found useful, especially with the initial workup, is a food reaction panel. And that lets you know, it goes through the grains and the meats and the, different types of cheese and that kind of stuff. And you can see individually if you have an inflammatory reaction sensitivity to those foods. Cane sugar's on there, gluten's on there, gliadin, wheat, oats. So you can go through and say, okay, you might have a problem in this area, but not that. So you can tailor your diet to that particular test, which is helpful.
Yeah, and again, I think you just need to be careful on an individual. I love doing that, but too, if I have an individual that's also low weight, I might be a little skeptical of doing food restriction too. So, I mean, right, it's just so hard for me I don't know where everyone is in the group, but good to look at food as inflammation, but also I think it's a key point to a lot of studies show you want to have fat. So like fat on your body is good. Don't, the goal is not to be skinny, losing weight in this case.
Right,
where was that 40 years ago for me?
Fat phobia.
Yes.
Yeah. And you look at the rise really in Alzheimer's and MS, and I think that's from the birth of fat phobia.
Right. Well, yeah, in the 90s where it was like no fat, and now you have this rise in dementia and Alzheimer's, which is not. Now sugar, and that's a different subject, so I'm not going to even go there.
Right. Yeah.
Stop myself,
yeah.
but.
So generally what I say is if you take carbs, eat protein. That's kind of the general rule for me.
Mm-hmm. Anyone else? Glenn, you've been quiet. Oh, hold on.
He's muted. Or she.
Can you unmute? Thanks, Mary.
Yeah, I'm not speaking very well, so my voice is starting to go. But yeah, you can throw calories at you, but you got to eat good calories. Your body is already polluted. Right. So you can't just go and throw garbage at yourself and count it as calories.
Correct.
Yes. Yep. And that's kind of what I was speaking of in the study when they were talking high fat. They didn't specify omega-6 versus omega-3, and omega-6s are inflammatory and omega-3s are anti. So that's where I'd say, these studies are not looking at things that we think are cool in the health, like diet department. So we can step up and do even better than their study. So absolutely. I mean, calories are very important, but good quality calories is a step up from that. Yes.
And you've talked about chelation?
Yeah, so chelation, there's 3 different components or compounds we use. If you're talking about IV, it's usually EDTA or DMPS. Orally, we use DMSA. However, that's the more, the stronger therapy. We do have the second line, which is like the activated charcoal or zeolite, things like that. So it depends on where the person is. We match that with that case.
So I heard that the IV chelation is harder to take than the pill form.
That's correct. It's stronger. So there's 2 different modalities. You can try to treat the cardiovascular system, trying to get the plaquing and everything's out of that, or you're trying to get it out of the GI system, the nerves and things like that. That's more the heavy metal style. So both of them remove heavy metals, just different mechanism. If you have depleted nutrients, which we see on the heavy metal test, it's the second page, it's the essential elements, then you could see if you need magnesium and molybdenum or zinc or copper, whatever that will normally be depleted with EDTA, you can supplement that so you don't see those side effects, that stronger effect.
Yeah, I just started chelation. I'm doing the pill form.
Okay. Yeah, great.
Yeah, and I mean, with any sort of chelation, for you guys who don't know what chelation exactly means, I mean, we're pulling out heavy metals. So like mercury, lead, we usually test beforehand. It can pull out some other things too, but that's really geared towards metals. And you have to remember that metals and minerals also can pull out good stuff. So you have to be careful for calcium, magnesium, and people, it's prescription based. So not anyone can just go and get this done without seeing a doctor. I mean, like one of us could help too, but medical doctor, naturopathic doctor, those are prescriptions to help pull things out. You need someone to assess you safely.
So what's the waiting list to get in to see you?
Oh man.
I think we're in November. We're pretty busy. All of us are fairly busy, which is good, but bad. We do have a waiting list, and I think now with we just added our naturopathic doctor that helps with cancer. So now we're having some maybe more openings because all of our cancer patients are going to him. So it's opening up holes in our schedule. So thankfully that should be helpful moving forward. And we're even trying to look for maybe another additional doctor to come. We just need a bigger spot in place. So we're working on a couple things, but not helping anytime soon, I suppose.
When I send my follow-up email, would it be beneficial to add the email address along with the phone number? Or would you rather people just call to make an appointment?
Probably call, because the front desk deals with all that stuff.
Okay.
So yeah, I mean, you would call and one of the front staff would help. Again, you can ask to be put towards a waiting list, and especially if your schedule's fairly open and we can do Zoom or phone or in person. And, you know, if you can be a last minute add-on because you can do a Zoom call, I mean, that helps move you closer to the top. You know, if you don't work or anything like that, it's easier to get in quicker than when we have a last minute cancellation or no show.
Can I ask a question?
Yeah.
How do you know, when do you know, and like for Glenn, when did you know chelation was something that should be the next thing that should be tried?
Well, we test for it. We do a heavy metal test, and if it's positive, then we focus on that and incorporate the treatment plan based on that, and then follow up testing is important too with that.
But it's a special doc to do that though, right? A special doctor to do that?
Yeah.
That's a urine test. Yeah.
The reason why I did a chelation is the reversals that Ben Benlock has. Almost every one of them's done a chelation.
Right.
It was part of the reversal.
Yeah.
So I went in, and I am high in farm chemicals and also metals.
Okay.
Now, when I was checked at Madison and also up in Mayo, and I was fine.
Yeah, they did a blood test.
Right.
So it's a different ball game. You don't have these heavy metals that are hanging out in the bloodstream. They settle down to tissue.
Yes.
And that's where a provoked test is by far the gold standard in functional medicine. Yeah.
That's right.
Yeah.
I just wanted people to know that.
Yeah.
Yeah. And you know, not everyone has to do the same pathway too. So there are people that come to us and they say, hey, I read this, I want to do this, let's do it. And we're all like, yes, let's do it. And then other people want to go slower. And, you know, I think there's 100 ways to assess a person, and what way is the right way is just really digging things out of your bucket. So we all have a health bucket. Some people have really big buckets, and those are the people that can do all these yucky things in the world and somehow are still really healthy. And then some people have really small buckets. And those are the people that get sick all the time. So whatever your bucket is, like maybe you have some genetics that got thrown in the bucket, and maybe some stress got thrown in the bucket, maybe some heavy metals, maybe some hormones, maybe some food sensitivities. I think our job is really to pull out what can we find and pull out of your bucket so you're not overflowing. Any reduction of that load will be beneficial. So you could say, oh man, I don't want to do heavy metal or chelation. Okay, well, let's look at something else then and maybe pull that out of your bucket. So and some people want to do every bucket pulling mechanism, and some people want to be simple. So there's that's the cool thing about our job is you could see me or Robert, and we might have two different plans for you, but guess what? You possibly could still be getting better doing 5 different mechanisms.
I love Dr. Georgia's bucket. That's a good analogy. You and your analogies are fantastic.
Thanks.
So I just quickly, with heavy metals, they plug up biochemical pathways. They prevent the healing process. They prevent the metabolism. They prevent creation. So if you have lead, mercury, arsenic, cadmium, uranium, things like that, they're toxic. So they can deplete oxygen. They can kick out iron. So what we want to do is, based on your tolerance, you want to start to remove those, and you see like the flow. It becomes your energy becomes lighter. You can have more restorative power once those are kicked out.
And I also had carbon dioxide.
Man, you've been through the ringer.
I was an auto mechanic.
Okay.
Makes sense.
Yeah.
So, and I just want to put in a plug while people are waiting to get into your clinic. It doesn't hurt to ask your doctor. We had really good luck. We had a scientist doing research for us, and everything we asked Dr. Fatigue to test for, she did in the way that that we asked. And I don't know that you'll always get that, but it doesn't hurt to ask while you're waiting for in the meantime to get in.
Yeah, we love to collaborate with doctors. I mean, we have MDs as patients, so it is important to network and be on the same page, especially when you have a patient that's, you know, a failing. So we want to make sure we all have a group mentality and not just us versus them, because that volleyball match is not that favorable. People get confused and get misinformation and they tank. So we want to make sure we have, you know, everyone involved that's willing to talk and be a part of it.
Yeah. How do you collaborate with like the MDs and
neurologists stuff? Usually it's a peer-to-peer, and usually it boils down to them saying that, okay, we can't do what you do. We'll let you deal with that and leave us to our path. And we, you know, it's usually in the tune of let bygones be bygones, but informing each other of what the path is, because sometimes you're locked into a protocol or medication or whatnot, and if it's not working, you're seeking an alternative path. So you want to make sure you have, you know, at least the primary care neurologist or gastroenterologist in the know, because if something happens or, you know, they have a procedure coming up, you want to at least, and they look at the supplement list or medication list, they want to know why they're on it. So having that information ahead of time is helpful.
Right. Anyone else? This is very informative. I have like 4 pages of notes.